got massive long waiting list, 7.7 million people on the waiting list. We have seen over 900,000 operations and appointments and treatments cancelled in hospitals as a result of NHS strikes over the last year or so. Consultants, junior doctors, nurses, you name it. And now we are, as of 7 o'clock this morning, into the longest strike in NHS history by doctors. 6 days. I think it's 144 hours. Help me on my maths. They're going to be on strike in A&E, in emergency as well. And we are looking at possibly 200,000 operations being cancelled, taking us over 1 million being cancelled. Not to mention all the appointments that weren't made. Once they announced the strike dates for late December and January, well, they don't book appointments in for those days. I had an aunt who had an appointment cancelled in one of the strikes last year. It was moved by 6 months. People waiting 6 months for an appointment, having it waiting another 6 months. Question I'm asking people today is it immoral for doctors, junior doctors, to strike for 6 days in the busiest week of the year for the NHS?
I think if it's not definitively, it certainly borders on it, because I think there has to be a degree of trust around this. Ultimately, nobody wants to say to any sort of profession, really, that you don't have the right to strike, but there does come responsibility with that. And that is when you have certain times a year, and this is the big one, everybody knows it, you don't go on strike. March, April, take it all off, take August off, I don't know, like France does.
It's like, if firemen went on strike, on bonfire night.
Yeah,
it's just wrong.
It is a betrayal of the public trust. Well, the public are not sitting there going, oh, you don't deserve to strike. They're sat there, most of them saying, actually, yes, we support the right to strike and we understand things are very difficult, but you are there to provide an emergency service that we pay for at critical junctures, and this is one of them. And I do think, actually, we'll lose a lot of public sympathy. Whether or not that affects what the junior doctors think, I don't know, but certainly I think a lot of people will say this is unacceptable.
The battle still goes on in terms of the doctors are asking for 35%. Even the consultants didn't get anything like that. No one thinks they're going to get that. They said that will take them back to, I think, pre-2010 pay levels if they'd gone up with inflation. Well, you know what? Most people in this country have seen their pay dwindle as a result of the economic crisis and then lockdowns and then the inflation, subsequent inflation. So, again, some people can afford it more than others. Doctors are not. Your average doctor, I mean, they are higher paid than average. But you'd want them to be, wouldn't you? People who are highly trained, highly skilled, done a lot of training and who are saving lives.
The amount of work they do.
The amount of work they do. I'm very in favour of that. However, there is an argument we need to pay doctors more if we can't get enough doctors to stay in the NHS. Laws of supply and demand suggest that. But I do find it extraordinary how many of them are saying, I believe in the NHS. We need to have more money. It's all about keeping us in the NHS. And if I can't get the pay I want, I'm going to leave and go and work in Canada or New Zealand, where they don't have an NHS structure remotely similar to ours. They have these sort of social insurance systems which work much better and provide much better healthcare outcomes. Weirdly, higher pay for doctors.
I think people would feel more sympathy if, counterintuitively perhaps, people might feel more sympathy if doctors were honest. Most doctors do not go into the medical profession because they want to be sort of these wonderful angelic creatures, much like lawyers. They don't go into it to become human rights. They go for remuneration. They go for money, the same reason everybody works.
Hold on a second.
No,
you can
that's true.
No, a lot of these people, bearing in mind, a lot of these people, you're basically a straight A student to get into medical school. They do a lot of training, get a lot of debt from it. Most of those people could probably go and get themselves a higher paid job in the city or in business, but it's something they want to do. I've got no issue.
I don't believe that that's true at all. I don't think that the average doctor could very easily go and work in the city. I don't think that they're transferable skills. I think it takes a great deal of dedication, but there is a recognition that it comes with a lot of social status, and it is well paid.
That's true. The respect. If someone says, oh my, what does your kid do? Oh, they're a doctor. You go, oh,
yeah, you're respectable. You're intelligent. You earn a decent amount of money. Actually, it is not.
You're a good catch.
You run into a burning building and you resuscitate a child. That's not the first thing that comes. It is not actually necessarily about the morals. It is about where is your standing in society. And the thing with that is it's money and it's prestige.
I think also, a very rewarding job. I say my mum was a GP. She was, junior doctor for much of my childhood. I remember the hours they worked then. And she found it so rewarding. She virtually had to be dragged kicking and screaming into retirement when she was about 70. But is it this is the thing. Doctors and nurses, they are allowed to strike. I mean, nurses have never gone on strike. We know that the RCN is not a sort of a strike-happy union. You know, some of the teaching unions, National Education Union, I mean, they'd rather not be in the classroom ever. I mean, they just don't feel any need to have any contact with children at all. They don't want children educated. Easier to be malleable into their socialist thinking. I mean, they are not about the children at all. The RMT, ASLEF, they'll go on strike at the drop of a hat.
They couldn't care less where you're going.
Do you think this is now sort of a political thing, that this is actually about the BMA? They are, it's a bunch of, sort of card-carrying, sort of, Labour, anti-Tory, get the Tories out, save the NHS from privatisation. No one was threatening to privatise it. And actually, it's a political battle, and it's not even about the wages anymore.
I do wonder about that, if that's the motivation for not all, but certainly some of them. And from conversations I've had with junior doctors, there is a feeling that at the upper echelons there is an element of that. But ultimately, I suppose the question would then be would Labour actually be able to come to the table? Are they doing it for ideological reasons, as in they want there to be a Labour government, or do they feel that they'll get a better deal out of Labour?
Yeah.
And I think what you've
good luck
seen...
with that.
Well, that's exactly the thing. Actually, Wes
Streeting
has been pushed to the front because he is seen as this sort of quite reasonable character, but he's been very sort of online, saying the NHS is not the pride and joy of the world. It can do a lot of things that are better, and, oh, by the way, there's no money. So if that is the outcome that they're hoping for, I think they're going to be rather disappointed.
But that's the thing, is there is plenty of money. I mean, that's another story I want to come on to, very much linked to this, from the Mail today, is about the huge, bumper pay packages for an awful lot of the executives.
Yeah.
I mean, huge numbers of jobs are advertised in the NHS where they're in, sort of 70, 80 grand. I mean, way above average incomes for people working in diversity, whatever. But we've also got these chief execs who are on, I mean, they've actually found the 11 trusts with the longest referral waiting times, where the average delay for treatment is wait for it more than a year, all earn more than the Prime Minister, some significantly so more. Earning things like, bonuses worth up to 30 grand a year. Now, if you've got waiting lists that long, you're not entitled to a bonus of any sort whatsoever.
This is the thing. Hypothetically, I'm fine for hospital managers to potentially earn a lot of money, but it has to be performance related, because let's be clear, the NHS, it's vast, it's very complex. It does need talented people to help knit the thing together.
And they say they have to compete.
They have to compete,
for the private sector.
Sure, to get people out of the private, because you can earn a lot of money doing the similar sorts of things in the private sector, but it has to be performance related. And if we're going through the worst performing trusts and we're not seeing a massive improvement, then I think questions do have to be asked. Actually, is this person worth the money? Could we not give the same amount of money to somebody who would come in and 6 months in a year say, I will do X, Y, Z? Well, why are we sort of sticking around with these people who are not doing performance?
And also, again, it's that revolving door, with people who, work in various different NHS bodies. I mean, I think an awful lot of people have got a lot of faith in the doctors and nurses and the other clinicians who help them, and, the cleaners and the porters and all. I mean, there are so many people involved in healthcare, but rather less in the absurd levels of management that we have seen. We are spending a lot of money on NHS right now. There is more money going around than ever before, but it's not being spent in the right places.